Hello everyone. In this video, we will be running through about the basics of electrocardiogram part 2. This video is exclusively recorded to have a clear understanding about the ECG leads. A part 1 video of basics of electrocardiogram was uploaded that has highlighted about the definition and purposes of electrocardiogram, review of conductive system, understanding about the ECG wave representation, how to read the ECG paper, and calculation of heart rate from the recorded ECG. Those who are wish to learn this content can have a look on that video. I am Shobha, Professor in Medical Surgical Nursing Department, working at MMM College of Nursing. These are the specific objectives addressed in this video. Recording an electrocardiogram is similar as recording an event with the help of video camera. To capture the event completely, a single view is not sufficient. Instead, we will be using multiple camera angles. Likewise, multiple ECG leads must be recorded to adequately describe about the heart's electrical activity. The usual way of recording the ECG includes standard 12 ECG lead. These 12 ECG leads are subdivided into limb lead and chest lead. We have 6 limb lead, which is otherwise called extremity lead, and chest leads are otherwise called precordial lead. To record these 12 leads, 10 electrodes will be placed over the body surface area. Each lead has its own landmark, which we will be discussing in upcoming slide. For recording the limb leads, we will be using 4 electrodes placed over all 4 extremities that include right arm, right leg and left leg. From these 4 electrodes placed on extremity, we will be recording 6 limb leads. And for recording the chest leads, 6 electrodes will be positioned over the chest, from which 6 lead will be recorded. To talk about the limb lead placement, we have 4 electrode position on all 4 extremity. Right arm electrode can be positioned anywhere between the right shoulder to right wrist. Similarly, left arm electrode can be positioned anywhere between left shoulder to left wrist. For lower extremity electrode, right leg electrode can be positioned anywhere below right torso and above right angle. And left leg electrode will be positioned anywhere below left tarsa and above left angle. Regarding chest lead placement, there are 6 electrode positioned on the chest, that is recording 6 chest leads, which was labeled as V1 to V6. When in some ECG machine, it is also labeled as C1 to C6. The multiple chest lead recordings are giving a 3-dimensional view of electrical activity of the heart. As like limb lead, the chest lead also has its own landmark where the electrode will be positioned, where the B1 will be positioned at 4th intercostal space at right sternal border, and lead B2 will be positioned on 4th intercostal space but on left sternal border. Lead V3 will be positioned between V2 and V4. Lead V4 is positioned over 5th intercostal space at mid-clavicular line, where the lead V5 and V6 are positioned horizontally even with lead V4. Lead B5 is usually positioned on 5th intercostal space at anterior axillary line, and lead B6 will be positioned on 5th intercostal space at mid-axillary line. To talk about the limb leads in detail, the limb lead consists of standard leads and augmented lead. Standard leads are otherwise called bipolar leads, which includes lead 1, lead 2 and lead 3. These bipolar leads are recording the impulses difference between two extremities, and it also requires negative and positive electrode for monitoring. Whereas the augmented lead, otherwise called unipolar lead, which includes ABR, ABL and ABF. And here the unipolar leads are recording the electrical voltage of single location. Here the ABR stands for augmented voltage of right arm, which records the electrical impulses travels towards right arm. AVL stands for augmented voltage of left arm, that records the impulses travels towards the left arm. And AVF stands for augmented voltage of foot, which records the impulses travels towards the left leg. The spatial orientation and electrical polarity of lead 1, lead 2, lead 3 are schematically represented using an imaginary triangle, which is called Enthoven's triangle. This Enthoven triangle is the cornerstone concept in electrocardiogram. When we record the bipolar limb leads, lead 1 is positioned horizontally between right arm and left arm, which records the difference of impulses between left arm and right arm. Here, the left arm is acting as positive pole and right arm is acting as negative pole, whereas the lead 2 is pointing diagonally downward, which records the difference of impulses between right arm and left leg, whereas the lead 3 is also positioned downward diagonally, which records the impulses different between left leg and left arm. From this triangle concept, we can have a clear idea where the electrical impulses recorded in lead 1 and lead 3 is equal to the electrical impulses recorded at lead 2. And regarding the unipolar limb leads, each lead is recording the electrical impulses at single location. So far, we were highlighting about the usual way of recording 12-lead ECG system, where in specific circumstance, we will be asked to record additional ECG leads, where here in the chest lead along with B1 to B6, we will be asked to record an extended lead of B7 to B9, which is called extended lead or posterior lead recording. We will also place the electrode position on the right side of the chest and we will be recording the right side ECG. These additional ECG recordings are helping us in enhancing the diagnostic accuracy of myocardial infarction. These additional leads are helping us in detecting the ischemic changes, improves the localization of the injury happened to the myocardium, assisting in identifying the complex arrhythmias and conductive blocks. For recording the posterior leads, the electrodes will be placed on the posterior chest wall. For the lead V7, the electrode is positioned at left posterior axillary line at same horizontal plane where lead V6 was positioned, and lead V8 and V9 is also placed horizontal plane as V6, where lead V8 will be positioned on left tip of the scapula and lead V9 is placed on the left paraspinal region. Here, the posterior lead recording is crucial diagnostic investigation in case of a posterior myocardial infarction. We often ask for this posterior lead recording in case of inferior wall myocardial infarction because the artery, that is the right coronary artery, which supplies to the inferior wall, the same artery is only supplying the posterior wall also. So, whenever there is an inferior wall MI, it's become mandatory for us to rule out about the posterior wall myocardial infarction. The right-sided ECGs are recorded by placing lead V1 to V6 as a mirror image of the position which was discussed early in the chest lead placement. Hope you will be remembering where we were discussing the lead V1 will be positioned at the fourth intercostal space at right sternal border, and V2 will be positioned in your fourth intercostal space at left sternal border. But here for your right side ECG, which will be getting reversed, where V1 we will be positioning on the left sternal border and V2 will be positioned at fourth intercostal space at right sternal border, whereas the lead V3 to V6 will be positioned same as what we have already discussed. The same landmark will be used here, but will be positioned on the right side instead of left side. And here, the right side ECG is also always asked in case of a patient who is having inferior wall myocardial infarction, because the inferior wall MI patient often present with right ventricular myocardial infarction. When we need to record the ECG continuously, or when we have to connect the patient to the continuous cardiac monitor, or even in case of recording Holter monitor, we go for 3 electrode system or 5 electrode system. In 3 electrode system, the electrode, right arm, left arm and left leg are positioned on chest wall and on the abdominal region. The electrode right arm will be positioned at right infraclavicular fossa, and the electrode left arm will be positioned at left infraclavicular fossa, whereas the left leg electrode will be positioned usually at your lower left abdominal region at anterior axillary line. These 3 lead electrodes are helping us in recording standard leads, that is your bipolar leads, lead 1, lead 2 and lead 3 are recorded using 3 electrode system. In 5 electrode system, along with 4 limb electrodes, we will be having one chest lead also positioned for recording your ECG changes which is happening. So this 5 electrode system gives a superior identification of ischemia as well as arrhythmias while comparing to 3 electrode system. And here we can monitor lead 1, lead 2, lead 3, and along with that we can also record the precordial leads V1 to V6. These are the references which was used for preparing the content of this video. We have come to the end of the video. Hope you had a clear understanding about 12-lead ECG system and additional ECG lead recorded which was discussed in this video. Thank you for your patient listening. Thank you.